together.
I'm just going to go like this.
Okay, so you'll be first.
Hi, I'm Bruce Johnson, and we're going to be going live starting right now on Facebook and YouTube. I'm here with my colleague, Adiande Till. Introduce our guests and let them know what we're going to be doing.
We are live right now on so many platforms, but if you want to swipe up, we have a live blog of all the questions and answers that you've been sending us about the coronavirus. And if you have any more, you can text them to us. We have Dr. Linda Nabha here and Peter Greenberg. You, my friend, are going to talk to us all about travel, and you, all of the health advice that we need about this. She was saying hygiene is number one. Let us know if you have any questions and swipe up for the live blog.
We're also going to be taking you to some places. You've got a report you've done on traveling, right? Travel restrictions, that sort of thing?
She killed it. She killed it.
She killed it? Did we go to black?
Are we already live?
We killed it?
No, just on Instagram. It's just a video.
So let us know when we have the countdown to go live on Facebook.
Oh, I thought that's what we
Oh,
were
we're
doing.
live right now.
We are live right now.
Hello, friend.
And this is what happens live. Okay. Have we introduced our guests? I mean,
Not to Facebook. Go ahead for it.
Okay. You introduce our guests. Adiande Till, my colleague here.
Hello, everyone. We are doing a 30-minute special on the coronavirus. We are all about presenting the facts, not about peddling fear. We have Linda Nabha right here. She is going to give us the medical perspective of all of the hygiene tips, all of the medical advice that people need to take heed of, correct?
All right.
Infectious disease specialist here.
There we go.
One of the best.
And then Peter Greenberg, you must know this man's face. He is CBS's travel editor. He's going to take us through all of the must-dos and must-don'ts when it comes to traveling during this season.
Yeah, and you got a lot of questions out there, and we've already, tried to get some answers by getting out into the streets. You've done, the traveling industry, looking at
Exactly.
that. We also visited a restaurant because we're interested in those employees who are day workers, who don't have all the benefits that the rest of us share. What happens to them if they have to be quarantined? How do they pay their bills? How do they pay their rent? How do they pay, their utility fees? Are landlords going to understand this? Some people do have coverage because the D.C. Council did something that a lot of local jurisdictions have not done, and that is family leave. Okay, which is mandatory in this city, which is a good thing, but it may not be enough. So we're going to be talking about all that stuff tonight.
The story that he's talking about, we had that question yesterday in the studio, and Bruce went out and talked to one of our local business owners to get that answer for you, basically in real time. So he'll have that answer, but this is the way that you can interact with us live throughout the show. We have a text message. We have a text number that you can do. It's 202, correct me if I'm wrong, social team, 202-895-5700. I believe that is correct. If you text that number, it'll come directly to us, our tablets, our cell phones, anything you do, and send us that text with your question. Our entire team, I don't know if you can see them back here, they will be answering those questions in real time. And this is the best part.
Yeah, you're going to hear more than once tonight that this is about facts, okay? This is not about panic and that sort of thing. There are no cases thus far in the DMV.
Correct.
People have been tested, but there are no cases, and low risk, we keep hearing, from health authorities. That's important to say time and time again. So there's no reason to panic. Right now, we're gathering information. We're finding out who's got a plan, should it get worse, because you've told me more than once. We're going to see cases eventually.
Exactly.
Mary Riesling is watching from Georgia. That's what's so cool about this show. We get to talk to people from all over the country that are dealing with varying degrees of this virus right now. If you're on the West Coast, I believe you'd be a little bit more scared than we are here. But right now, Bruce, the DC Health Department is saying this is a low risk area, correct?
So far.
So far. Okay.
Yeah, and some people are making their own decisions and doing them quickly. There's been a run on some supplies and goods already in some places, okay? Hand sanitizer, a lot of these things you can't find.
Right. Our Sarah Cosmo just did a story today about a place in DC that happened to have a sign up and said, we have the supplies you need. If you need that article, it's on WSA9.com. Our team, the Q&A team back here, they will send it to you. Let me show you, Kyle. Let me take you over here. This is Laura. She is our website maven. You send us questions. This girl is on top of it with any of the reports that we have done previously. She'll get that link right to your phone. Then our Mike Wise. Hello, sir. He's back here manning the phones too. And Jordan, our data journalist, he is breaking down. What is all that information you have for us tonight?
It's just so much numbers.
So many numbers. All the numbers you need to know in a really easy way. I'm excited. I'm excited that we're going to answer all these questions.
This is what we're here for. This is what we do. This is how we earn our money. All that money they're paying you. This is how you earn it.
There's money involved?
Yeah.
Wait a
sort
minute.
of.
Nobody's
Not for everybody. It's not like you need it. I mean,
We're 30 seconds left
Never.
from the broadcast on television. So if you're watching us from your homes, let us know right here online. I'm going to go over to my spot.
Okay, we're going to pause right now. We're going to dip to black. Then we're going to come up into the live broadcast. Okay?
Welcome to the Q&A, where every story starts with your questions. We'll dig in and show you how we got the answers. Real questions, real answers, real perspective. Really. This is the Q&A.
Good evening, everybody. I'm Bruce Johnson, and welcome to the Q&A. Thanks for joining us. Tonight, we're focusing on the coronavirus. Remember, health authorities in Maryland, Virginia, and D.C., they say we're at low risk. We received a lot of questions, and here at WUSA 9, we want to bring you the facts tonight. And tonight, we're talking to Dr. Linda Nabha, an infectious disease specialist here in Washington, and Peter Greenberg, CBS's travel editor. There's still time to send in your questions to them. Adiande Till is here to show you how to do it.
Bruce, this is the most exciting show that we have because it's all about our viewers in real time. This right here is our Q&A research team. We have Laura, Mike, Mia, and Jordan. And all throughout the night, they are watching for your questions to come in. However you send them, there's so many ways that you can reach us tonight. The very first one, write this number down. It's going to pop up at the bottom of your screen, 202-895-5700. You can text us your question at any time throughout the show, and this team, they are on it. Your message is going to pop up on our screens. Oh, actually, like this one right here. We just got one from Poonam, who wants to know if traveling on the metro is safe. Fun fact, Pete Muntean just answered this question yesterday, so I'm going to get the team to send you over that link right now. It's really that easy. Now, if texting is not your thing, you can email us. Go to the Q&A at WUSA9.com. And of course, don't forget about social media. That is our bread and butter. Our Q&A research team is always monitoring Twitter, Instagram, Facebook, our live stream on YouTube, and everything, really. If you have a question, send it to our team. We'll answer them throughout the show.
Yeah, thanks a lot. Okay, let's start to update the numbers for you right now. Total number of cases in the U.S. is at 159 right now. 12 people have died, 11 in Washington State, 1 in California. 8 people have made full recoveries. Now, locally, there are 3 confirmed cases in the state of Maryland. All are in good condition. We'll learn more about that tonight from Governor Larry Hogan. Locally, there are no confirmed cases. Health officials are waiting for results on 3 tests in Virginia, 2 in the districts, and 14 in the state of Maryland. Compare that to the rest of the world. Globally, we're looking at almost 100,000 cases and more than 3,000 deaths. Congress wants to get ahead of any possible outbreak in the U.S. Today, the Senate passed an $8.3 billion plan to fight the virus. It will pay to study and develop a vaccine, support state and local governments, and distribute more test kits. Now, over 1 million have already been sent out. The bill now heads to President Trump. The impact, of course, being felt on Wall Street. Dow fell another 3.5% today. That's nearly 1,000 points. It's down more than 3,000 points in the last month. The impact goes beyond the markets, though. We're seeing a shortage of everything from hair weaves to wedding dresses and foods, all coming from China. Here's a question that we're getting every day. What about restaurant staff, waitresses, bartenders, busboys, or day workers? If area workers who are living check to check have to miss work because of the coronavirus, what financial help is available to them? We found there is some help for some workers.
Our losses are losses. If we have to close for whatever reason, because of this, because of fear, because of dropped business, we're out of luck.
The Busboys Imports restaurant chain employs some 700 full and part-time workers.
I always have hand sanitizer with me, and I make sure I wash my hands after every time I touch a plate, especially cash. I always wash my hands after that, because it's really germy in here. People stay in here a lot because they're on their laptops or just doing their work for the day, so people can be in here for hours.
Protecting themselves from the coronavirus means guarding themselves from their fellow workers and thousands of customers who come in contact with them every day.
We are being very cautious, though. We're telling our staff to make sure that they don't show up to work if they're feeling at all sick.
Andy Shalal is the founder and owner of Busboys. He's got 7 restaurants in the area right now, with 2 more on the way in Columbia and Baltimore. If his workers get sick and have to be quarantined, there is some help.
A few years ago, much to the credit of the City Council, they actually took on the Paid Sick Leave Act, which ensures sick leave is guaranteed for every employee by the employer up to 7 days per year. We have that, of course, but we also have additional leave for people.
Business hasn't suffered yet, says Shalal. Customers continue to show, but
I think, D.C. is not one that's been affected by this at this point, but I assume it's a matter of time.
And each law says there are scores of mom and pop businesses in the city that are not able to offer leave benefits. That means scores of part-time and day workers could be on their own if forced into quarantine from the coronavirus. Now, joining me right now, Dr. Linda Nabha. We've got breaking news, and we tried to get it into you earlier, and that's where we were stumbling. We've got confirmed cases right now as we speak in the state of Maryland. The governor has scheduled an 8 o'clock press conference. You knew this was coming.
I knew this was coming. This was no surprise. We were waiting for this. We have testing now at the Department of Health in Maryland. Those tests were confirmed at the Department of Health in Maryland, and we knew it was coming.
We don't have a lot of details at this point, but if we've got, just based on your experience, if we've got 3 confirmed cases,
Yes.
And we don't know if they're at the same place or if they're 3 separate cases at this
Right.
point, but what does that really mean? That means it's bigger than 3 at this point, probably.
We know that if they've tested positive, meaning they probably presented with symptoms, meaning that they may have had the infection for up to 14 days. So we know that it's at least been circulating in Maryland for some period of time.
And that says to me all the people they've come in contact, beginning with immediate family, then if they work, if they go to
Exactly.
classes, whatever, there are other people potentially exposed
Right,
also.
exactly. Remember, Bruce, this is a respiratory droplet infection. So anyone that they may have coughed on, they may have sneezed on, anyone that's touched the respiratory droplets is at risk.
And again, let's say right now, what are the symptoms? What should people be looking for?
So symptoms that we know of are non-specific. What we do know from China, and the symptoms from China, is that people present with flu-like symptoms. Most commonly, those who have detected virus, those who've tested positive for a virus, majority of them have a fever, have a cough, shortness of breath, myalgias or muscle aches and pains. And then there are some cases of diarrhea or gastrointestinal problems.
Yeah, I think we heard from the vice president today. I think he says that we don't have enough kits to meet the demand at this point. What does that say to you?
It's a little concerning. I mean, we are operating on the idea that we need to test these people and find out who's positive and then go from there. So if we don't have the testing, then we can't treat and evaluate those people and those that they've come in contact with.
And who's tested? Just the people who display the symptoms, or is there an at-risk population that ought to be tested immediately?
Sure. So there's no surveillance testing at this point. Right now, the criteria is if someone comes in with respiratory infection plus a fever, and they've either traveled to particular countries or they've been exposed to a population where there is community spread at this point, or right now, just today, the guidelines have been updated that if someone is in a nursing facility or at a hospital and they're presenting with these symptoms, then they should get tested.
You know, some people are asking the question right now. They're getting information that they will all have some form, show some symptoms, if only a mild version of the coronavirus. Any truth to that?
So we do believe that people have had a very mild form, so mild that they didn't necessarily have to present to a hospital or a physician. In fact, there have been documented cases in China of people who haven't had any symptoms who've tested positive for the virus.
Okay, don't go anywhere.
Okay.
Dr. Nabha, we'll get some more answers from you. We're going to come back to this. As we just said, there have been 3 confirmed cases at this point in the state of Maryland. 8 o'clock tonight, governor is calling a press conference. I'm sure we're going to be taking it live. We'll be back.
The Verify team is all about facts, not fear, when it comes to the coronavirus. That's why we've been busy over the last month verifying some of the biggest questions we've heard. Here are just a few of them. First, people have a lot of concerns about flying right now. A viewer asked us whether planes are disinfected after each flight to combat the virus. Now, we found that there's no uniform policy, but yes, all the airlines that we contacted say it's common practice. We were also asked about flight insurance and whether it covers you if you cancel out of fear. Our experts gave us the bad news. No, you're not covered. We also covered stigma and how people are spreading rumors about getting coronavirus by eating Asian foods. This, of course, is complete nonsense. You can't get the virus from food, you can only get it from people. Speaking of myths, we debunked miracle cures like garlic water, gargling mouthwash, and spraying chlorine all over your body. We also cleared up a myth being shared online that Lysol may have predicted this latest outbreak. Of course, that's false. People were confused about Lysol's label that shows it can kill human coronavirus. The explanation here, there are many types of coronavirus that have been around for decades. Now, we showed our work for all of these stories, and if you want to see what the experts said about each of these claims, just text us the word verify at 202-895-5700. We'll send you the full story.
With spring break just around the corner, a lot of our viewers are asking us about their travel worries and concerns, and that's why this guy's right here. CBS travel editor Peter Greenberg is with us to answer questions like this one from a viewer in Virginia who wants to know, is it safe to fly to the Caribbean right now? We're going to be answering that question and more on the WSA9 Facebook page and YouTube pages right now during commercial break, and then when we're back, you, my friend, are tackling a lot more questions.
No, I'll be in the Caribbean. No.
Text us your questions at 202-895-5700. We'll be right back.
Okay, again, we're Facebook Live. So I want to go back to our breaking news because this is kind of stunning. It happened while we were, live on air. They've got 3 cases in Maryland where people have tested positive.
Right.
Which says what to you, to the medical
Which
profession?
tells me, it's not as stunning for me. I am expecting this. I'm expecting the DC metropolitan area to get cases of this. I believe that this is currently circulating, and now we have proof of it.
Okay, got a question?
We have a question from Gloria in Fairfax, and she wants to know if a person is given treatment as soon as a test shows positive, approximately how long does recovery take?
Okay, so here's the issue with coronavirus. There is actually no treatment for it. So when you think about how do you treat someone who has coronavirus, it really depends on how severe the symptoms are.
Okay.
So if someone is presenting with a very mild symptoms such as a mild cough and upper respiratory infection, and they can be home, the idea is to keep them home.
Got it.
If someone is presenting with more severe symptoms of respiratory failure, well, they need to be in the hospital and get supportive care.
Understood.
This virus comes into the body and does what? I mean, if there's no vaccine,
do you mind
how do
saying
you
with your
treat? Are you
light
just
stick?
treating symptoms? Is that what
Yeah,
you're...
exactly. So you're essentially giving supportive care to however they're going to present.
So rest and fluids, I mean, kind of stuff like the
Rest
flu.
and fluids, and if someone is elderly or has, a respiratory, failure, they need oxygen. They need to be evaluated by the intensive care unit in the hospital, so they need further evaluation.
Okay, I'll go back. Okay. Okay, we've got some breaking news here, and it's happened in the past couple of minutes. Maryland Governor Larry Hogan confirms the first 3 cases of coronavirus in the state of Maryland. Hogan says all 3 patients contracted the virus while traveling overseas. He says they're in good condition. That's the good news. Now, this is important because we don't know where these people live, where they've been since they've been back in the States, and specifically in the state of Maryland. We don't know if they're in the Washington suburbs. We don't know if we're talking Baltimore. We don't know if we're talking Maryland's Eastern Shore. You can watch the governor's press conference with more info live on our Facebook and WUSA 9 sites. More questions to the doctor? We're going to go to Mike.
I'm Mike Wise, and I'm here with members of our Q&A research team. We're responding to all your texts as they come through. There's still time to send in your question about the coronavirus. Text us at 202-895-5700. The number is right along the bottom of your screen. Remember, health officials say right now we're at a low risk. Ariane?
Mike, the big concern that people have right now, and let me introduce you to Peter Greenberg. He's CBS's travel editor. Now, Peter, a lot of questions that they have are about spring break coming up and should we cancel trips? What do you say?
There's a big difference between concern and panic,
Okay.
common sense and fear. I tend to be on the side of concern and common sense. I travel more
side.
than about anybody you know, but let's look at some numbers here. Travel and tourism is the largest industry in the world. 1.4 billion people will cross a border this year.
Okay.
1.3 billion crossed it last year. We're talking about some serious numbers. Now take a look at the number of cases that have been reported outside of China, Korea, and maybe Italy.
What are we talking here?
Minimal number of cases.
Okay.
I was in the Caribbean last week. I'm going back next week. I go for a day. I'm not on the beach. But the point, I'm working. But the point is, if you look at the numbers, the optics don't look good because people are worried and they're concerned.
Exactly.
But the real numbers to me are not as concerning. I'll give you an example.
Okay, please.
As we're talking right now, there are 365 cruise ships sailing around the oceans of the world.
That's a big scare point for a lot of our viewers.
Sure, because most people think that they're a floating petri dish, but we'll get to that.
Yep.
Of those 365, by the way, none of them are now in Asia or China. So of those 365, how many were actually affected by the coronavirus? You ready?
Okay.
Uno. One. Okay?
That's a very small number.
So listen, given that choice,
Yep.
I don't want to take my chances on the subway in New York. I'll go on a cruise ship. And you know what? They're aware of it now.
Yep.
They're applying a lot of preventive measures in terms of antiseptic work.
Right.
And it's basic common sense. Do what look, I'm not a doctor.
Right.
I don't play one on TV, but while I'm on TV, I will say this. Follow your mother's advice from 1956. Wash your hands
Yes.
before you go to the bathroom and after. Wash your hands before and after you eat. And what they're doing on the cruise ships now, which I think is very interesting, is many of them have eliminated the buffet lines. No salad bars, folks.
That is a good thing.
You're going to get your meals served to you by waiters individually, and that's the way it should be.
Oh, we just got a message from Paul Ford. He's an Uber driver.
Yeah.
He wants to know, should he be concerned about getting sick and should he stop driving altogether?
My question to you is, how long have you been driving for Uber?
But this is a valid concern. So many people are going to get in and out of that
concerns,
car.
But let's talk about a valid answer. The same application of the antiseptic wipe.
Okay.
Look, if you're going to go on an airplane, you just take some of those antiseptic wipes,
Right.
you wipe off all the surface areas that your skin might touch. The tray table, the armrest, the seat back cushions, and don't forget the nozzle above you where
Right.
the air comes from. You do the same thing in the Uber. It's going to take you all of 14 seconds between passengers. Da-da!
We are going to answer so many more travel questions during the commercial
Yeah.
break. But Mike, you're with Linda Nabha. What are you guys talking about over there?
Yeah, Dr. Nabha, I've got children, 3, 9, 5, and 2. I know you've got a couple boys. I'm going to ask you in the break on Facebook Live what to do if you're a parent and you're panicked.
Right.
All right? Thank you.
Yes.
Back with Facebook Live. Ariane, Dr. Nabha, Peter. I'm a dad of 3, 9, 5, and 2. I'm scared to death of my children getting it. From what I've read, children's immune systems have basically not repelled it, but they're the least affected. Can you talk about that?
So, I mean, generally children can be a little bit of a high-risk population for infections, right? I mean,
They're always getting sick.
They're always getting sick. They have the common cold. They've got runny noses. You're constantly running to the doctor's office. I know I am. And I'm an infectious disease doctor. Sometimes I throw my hands up in the air. I'm like, what are we going to do?
Right.
But in this particular infection, we are seeing very mild symptoms in children. In fact, some children are testing positive for the virus and they have no symptoms.
It's amazing.
It's quite amazing.
We have a question asking then, who is most at risk of getting this?
So the at-risk population, and the data that we know this from is from China. So individuals who are over the age of 60, Individuals who have respiratory problems to
Pre-existing.
start with.
Pre-existing.
Okay.
Pre-existing respiratory problems.
And smoking in China is a really big deal.
And the fog and the air quality is pretty low there also.
Other than going to Caribbean with Peter Greenberg, how do we, for parents, how's the best thing we can do to protect our kids from this?
So right now in this area, we've got to instill the values of hand washing, talking to our children about don't pick your nose, wash your hands before you eat.
We actually have to jump right back into
All
the
right.
TV version of this,
Thank
so
you.
we'll come back
Thank you.
back to Facebook.
So welcome back to our special, our Q&A special. This is our digital investigative reporter, Jordan Fisher, one of the best in the business. Jordan, people are asking us, if the number of deaths from the flu are so much higher than the coronavirus, why are we paying so much attention to this new virus?
Yeah, Bruce, so there's a couple things. One is that the coronavirus that we're seeing has what's called a reproductive number that is much higher than what we see from the regular seasonal flu. And the second factor is that its mortality rate is much higher as well. I built a graphic for you guys so we can actually visualize this. Take a look right here. You can see down there in the bottom left corner and in the inset detail I built in the top right there. You know, the coronavirus is 10 to 30% times more fatal than what we see from the seasonal flu. Seasonal flu has a mortality rate of about 0.1%, which means if you have 1,000 cases, you'd expect one person to die from that. What we're seeing right now from the coronavirus, and this may change as more cases come and we get more data, but about a 3.4%, which means out of every 100 people, about 3 you would expect to die.
All right, and let's tell them again. We've got 3 confirmed cases now in the state of Maryland. The governor's going to be holding a press conference. Got to ask you this. Why is the coronavirus spreading so quickly? Or is it? Does it just seem like it's spreading so quickly?
It really has. I have a second graphic for you. I love graphics. So we took a look at how this version of the coronavirus, COVID-19, has reached certain milestones compared to other recent epidemics. And you can see right there, within the first few days of the World Health Organization tracking this, it had already exceeded the MERS epidemic. Another few days later, it exceeded the SARS epidemic, and then it has now exceeded the Ebola epidemic and even the height of the polio epidemic in the United States. So yes, absolutely, it is spreading faster than other epidemics we've seen.
Okay, Jordan, thanks a lot. Good information. Coming up, Dr. Naba, a leading infectious disease expert here in the Washington area. She's going to be here to answer even more questions, and there's still time to text your questions to us, 202-895-5500.
Bruce, throughout the show, we have been updating the WUSA9 free app and the website. If you go to WUSA9.com right here, the first thing on our homepage, Facts Not Fear. This is a live blog from Laura. You met her earlier in the question center. If you click on this, it takes you right to her live blog with all of the questions and answers that we have been covering throughout the show. Now here's the thing, if you still have questions that we haven't gotten to, text them to us. The number is 202-895-5700. Bruce, it's as simple as that.
Okay, we continue to follow breaking news in Maryland. Just as we went on the air, Governor Larry Hogan confirmed the first 3 cases of the coronavirus in the state. He said all 3 people contracted the virus while traveling overseas. We're told they're in good condition.
Thank goodness.
Yeah, good condition. And keep in mind the things we've been hearing here tonight. You've been telling us what to look for. You've been telling us who's vulnerable and what the symptoms. anything that we haven't covered? Always like, I ask you that at the end of every show. What have we missed anything?
Have we missed anything? I think you've done a very thorough job, Bruce. Have we missed anything? I think, we need to start thinking about, we have confirmed cases in Maryland. I expect a community spread of this, which means that we all need contingency plans. We all need to be prepared. We need to be prepared on a personal level and on a work level. And if we have children, on a child care level.
Can I throw this? I'm sorry, go ahead.
Yeah, I feel like when people hear contingency plan, it's automatic panic. It's automatic fear. And we had Gary reached out to us on Facebook and said he is scared.
Right.
So it's how do we build this contingency plan, but be mindful that we need to be okay and stay safe and stay calm.
Right. Well, in my opinion, preparation reduces fear. If you can prepare for something, you can reduce the fear in that particular individual.
But let's talk about some numbers here.
Okay.
The 3 people who contracted the disease who are in Maryland,
Yes.
they did it overseas. They were traveling. What a surprise. This disease travels. This disease is going to continue to travel.
Right.
That's why you're not surprised that it's here.
Right.
People get off planes, they get on planes. Does
Right.
that mean you shouldn't travel? No, it does not. It means you do your you do your homework.
Okay.
You do
All
your
right.
homework.
Okay. Hold it right there. We're getting ready to go back on air. Welcome back to the Q&A. We continue the following breaking news out of Maryland. Just as we went on the air at 7 o'clock tonight, Governor Larry Hogan confirmed the first 3 cases of the coronavirus in the state. He said all 3 people contracted the virus while traveling overseas. Now, we're told they're in good condition tonight. Keep in mind, we don't know where those patients live in the state, whether they're in the Washington area, the Eastern Shore, or wherever. Watch the governor's press conference with more information live on our Facebook page and at WUSA9.com. That's tonight at 8 o'clock. Let's get a couple more questions in.
Right, we have this one that came in on Facebook, and I believe this is for you. What is the possibility of the virus mutating even more? Could we unintentionally see consequences from using hand sanitizer too often?
Right.
That second one is a big one.
Right. So the possibility of a virus mutating is very common. That's the influenza virus mutates quite often. That's why the flu shot doesn't always work, right? So we know that there are a couple different strains of this current novel coronavirus. Some of those strains cause mild symptoms. Some of them are causing severe illness.
Okay.
Dr. Linda Nava,
Yeah.
Peter Greenberg, thank you for coming. This has really been informational.
And a big thank you to all of you out there for all of your questions and concerns, and we hope that we've been of some help. This is not the time to panic, correct, Doctor?
not the time to
Not
panic.
the time.
It's
Just
the
get,
time to prepare.
get
Love that.
information and be prepared.
Right.
Absolutely. We're going to continue live on Facebook and YouTube.
Yeah, we are going to continue answering your questions from both of these lovely people who have joined us throughout the night. If you want to text us your questions, do it to 202-895-5700. You can also hit us up on social media like always. Use the hashtag the Q&A or go to the Q&A at WSA9.com. We really want to thank you both for being here.
Okay. We're here working for you. We will continue this on Facebook.
Yeah.
Don't go away.
Stay safe.
Okay, we're going to continue on Facebook. You know our panel by now. Let's get to some more questions. Right, we were talking about people not needing to panic. I'm sure people are sitting at home saying, easy for you to say. Okay,
Right.
I've got kids. I can't afford to take off.
Right.
How do you not panic? My thing, if you got a therapist, put them on speed dial.
Don't go
But
to
that's real.
Don't go to Costco. That would be my advice.
Well, I think knowledge is power. So keeping abreast of the news, finding out how much community spread there is in your particular community, I think will help with that. Keeping abreast, keeping good hand hygiene. We've been telling people, wash your hands, good hand hygiene, get your flu shot, talk to your physician. If you're concerned, call your doctor. If you have symptoms, call your doctor. You need to educate yourself, be knowledgeable, and facts, not fear.
So we got this question a number of times through Facebook, and I believe the digital team back here got this. Can a flu shot or pneumonia shot protect you from lessen the effects of the virus?
So that's a very good question. The flu shot does not prevent the novel coronavirus,
Okay.
COVID-19. The pneumonia shot doesn't either. What those vaccines do is they prevent the complications of the illness related to those vaccines. So it reduces your complications to the flu, and the pneumonia shot will reduce your complications related to strep pneumonia.
Here's one of the things I've discovered about people in this country. We can withstand and get through anything as long as we know where's the end. You know what I mean?
Well,
in this case, let me get this out though. In this case, we don't know where this ends. They talk about a vaccine, and we're talking maybe a year or more.
Right.
That's a long time.
That's
That's a
exactly
long
what I
time.
was going to say.
So-
If we don't have a vaccine, that's the most frightening thing.
Right.
Oh, this is a good question that just came in through text message from the 202 area code. If you see coworkers in the office showing flu-like symptoms, should they be forced to go home? That's a subjective question. We
I'm
can
not
all
a
weigh
manager.
in
Let
on
me
that.
answer that.
Right.
Absolutely.
You got to go home.
Absolutely.
Well, I
I
know
don't want
people
it.
love to gut it out, but I totally agree.
Yeah.
For yourself and everybody involved.
Take
I
one
think-
for the team by
Yeah.
going home.
Don't
Staying
be
away.
the superstar. Don't come to
Yeah.
work. Don't feel like you're gonna push through it. Go home, stay there, and monitor your symptoms.
But you did great reporting earlier today when it came to people who don't necessarily have access to all the PTO in the world.
Right.
What do they do?
Exactly. People are going to be making their own decisions.
Yeah.
And the reason why we did that story today, in part, they're vulnerable,
Yeah.
okay? They don't have the family leave and these other things.
Right.
Their people live from check to check.
Right.
Okay? If I don't go to work, if I don't show up, I don't get paid. If I don't get paid, I can't pay my rent, can't pay my utilities, and my landlord may or may not understand.
Well, speaking of that, we have another money issue here. Every airline that's canceling a flight, every hotel that's not booking a room, every resort, every spa, every restaurant, every retail operation, you're dealing with
People's
the largest
jobs.
industry in the world that is about to fall apart.
Right.
We're talking about an over $110 billion hit in the next 3 months, and another 3 months for it to get back on track. How many airlines have we lost in the last couple of days, and how many will lose in the next 6 days? This is a very devastating economic hit. But here's the good news.
Okay.
Nobody has to be a barricaded suspect. The bottom line here is our desire to travel is not that we want to travel. Our culture now means we need to travel. We don't like staying home. And you know what? We're going to find a way. If we're smart, follow the right advice, do our homework, you're going to be fine.
Peter, I know you're not a soothsayer, but Yeshiva University, Division III school in
Yeah.
New York,
Yeah.
essentially goes to the Pikesville, Maryland, Hilton Doubletree tonight. Their reservations are canceled. The hotel does not want them there because one student tested positive. Not a player, one student.
Okay.
I mean, I know you can't look in the future, but people are talking about the Olympics being postponed.
Listen, everything's being postponed right now. People are reacting just by fear. Right now, the cruise lines have told me last week that last week they had more cancellations than reservations. First time in 20 years that's ever happened. So if you're a smart and responsible traveler, is this a buyer's market for you or what? And
Meaning pay for your tickets now, but take the trip maybe a year from now.
well, right now, Los Angeles to Hawaii is $99.
Wow.
Right now, the airfare from Boston to London is $250. You can't fly on the Washington to New York shuttle for $250.
I feel like we're struggling to get people to get on Metro because they're so scared. Getting them to go across
Well,
these is
this is what's
that's
happening.
tough.
Just like 9/11, the parallels are very strong. After 9/11, nobody wanted to fly over a body of water.
Correct.
They stayed home. So what you're going to see is the drive-to market in the United States. Everybody's going to stay in their communities or drive within 300 miles. So domestic destinations are going to become very expensive.
Could you explain to us one more time, quarantine in place?
Yes.
What does that mean? Who are you talking to when you say that?
That's such a good one.
So quarantine is for 14 days, and you essentially need to limit your person-to-person contact. So you're essentially quarantining yourself from almost everybody.
What does the spouse do of the person who probably
and
has?
this is why a contingency plan needs to be put in place. You need to think about this as a family, at as your place of employment. You need to think about, what if I get sick and I go home? Where do I go? Where do my children go? Where does my spouse go? These are the things that go home, talk to your family about it, think of a plan about what could happen here.
That was literally Carrie's question. She said, what should my contingency plan look like?
And if
Now
your
we
marriage isn't going well, that might work out better for you.
You're a jokester. We have another
I
question.
love this guy. Levity is needed at these times.
I'm sorry, honey, I'm going to have to be quarantined.
This one is a long question, so bear with me on this one. What happens if you take a vacation outside of the country and toward the end determine that you possibly have been exposed? Will you be allowed back into the United States? who makes that decision? The locality where you are visiting, or is it the United States? We'll stop there and then I'll get you the rest of that question.
Well, the bottom line here right now is they're not screening a lot of people leaving, they're screening people coming in.
Okay.
They should be screening people at the point of departure. And that's not what's really happening a lot. They're always screening at the inbound. So
Right.
if I'm flying to Hong Kong today, when I get off that plane, there's going to be somebody taking my temperature and screening me. When they come back to the United States, that's what's going to happen as well.
A question to both of you. Are you confident that the administration is on top of this and we're getting all the information that we need? We've got all the resources we need, to tackle
That's
this?
a rhetorical question. You want me to answer it?
Sure.
No, of course I'm not confident. They don't have their hands around this. They don't have their arms around this. It's a learning experience for them right now. And we're all learning at the same time. The question is, can we get ahead of it?
But but when it comes to Korea, you're looking at drive-throughs of people going through, getting tested, and Korea has talked to me about the mortality rate compared to us in the United States. How are they doing?
Yeah, well, and Doctor could probably answer this more than what we've seen, but in some of the countries where the infection is endemic, and we're seeing a lot higher mortality rate, and we're seeing a lot bigger spread because they don't have the quarantine protocols that we do. They don't have the, for example, in the United States, if you go to the hospital and you present with symptoms that might be measles, not only are you quarantined, the health department is notified. They try to track down everybody you've been into contact with recently and get them checked. These countries don't necessarily have those protocols in place, certainly in some of the more what we would consider rural, but also densely populated areas in these places. And so one thing it does is it kind of skews how we see the data, because getting a case of coronavirus in the United States isn't necessarily going to lead to as many community transmissions as you might see in Korea or China. But the other thing is we do see, as those places get pop up on the radar, you'll see some of the big spikes in new cases that we've had.
Okay.
Doctor, can I ask you this? Are you confident about the administration, the government, and I'm talking about the public health, people, are you confident about the testing? They're going to be able to test all of those at-risk populations, if you will?
So I think testing is probably the cornerstone of this, right? Do we have enough tests? Who's running the tests, and how do we get those
Are the
results?
people running the test qualified to do the test?
Well, so
how do we determine
that's a
that?
very good question. Now, currently, the people who are running the tests is the Department of Health or the CDC.
Okay.
Just today, one of the commercial labs is going to be running the test also.
Which means what?
Which means, as a physician, if I'm going to test someone with coronavirus, I can actually send it to Quest Diagnostics, as opposed to necessarily sending it to the Department
But
of
how
Health.
can you test somebody? You've got a hallway full of patients.
Right.
Somebody may have the symptoms.
Right.
How do you do that? How do you separate that patient and that person is not coming in contact with all the other patients?
And there's one
Right,
other oddity,
right.
and that is, this is not a 48-minute television series where everybody gets resolved in 48 minutes.
That's right.
You send it to Quest Diagnostics,
Right.
what's their turnaround time?
Right. We don't know yet. We don't have that data yet. And who pays for the tests? We don't know that yet either.
People talk about social distance, and what does that mean in medical terms? Like Bruce and I right now, he could infect me if
Yes,
he
he
were
can.
if he had. Okay.
Yes. So as we said earlier, this is respiratory droplets. So if someone coughs, we think it's about 6 feet, right?
Okay.
Probably a little bit less than that. So maintaining that distance, of course, is going to be important.
I hear coughing, I think smokers, I think about the number of youth vaping in this country.
Yes.
How much more susceptible are they to contracting this disease?
Right. So the answer is we just don't know. We know that the youth are not as affected in other countries, right? We also know that smoking is probably a big risk factor for contracting the severity of the illness.
We don't like to offend people, okay? So as we leave here, you run into somebody. You and I, when we first saw one another coming in, the last time we saw one another, we shook hands. This time we're doing a little partial fist bump, which is kind of weak. We were doing the little elbow thing.
Forget the pull and
people
brawl.
have to change their behavior. So it's okay now. You can give us permission for this. It's okay to say, no, I don't shake hands anymore.
Right. So I literally go in my patient room and I give them a little jazz hands and say hello. So we're not shaking hands anymore. And it's not rude. I mean, we're protecting ourselves. So
it's kind of cool.
Yeah.
Hey.
Yeah.
Doctor, I have a question for you. One challenge that we've seen in trying to report this and put it into scale and compare it to some other things is even though coronavirus and MERS were both, SARS and MERS were both versions of the coronavirus, I think the reference point for a lot of people is the seasonal flu.
Right.
And so when we say there have been almost 100,000 cases and about 3,300 deaths, they say, well, there have been 30 million cases of the flu. There have been 30,000 deaths
Yes,
from the flu.
right.
Why are we so worried about it? And
Right.
you know, it's a matter of rate, it's a matter of scale, but maybe you can put it into terms that are kind of better than I can.
Absolutely. So the flu, I mean, we have some level of protection. We have the flu vaccine. We have antivirals, Tamiflu. We can give Tamiflu to those patients. And we know that the mortality rate for the flu is about 0.1 to 0.3%.
Right.
The mortality rate for the COVID-19 is probably about 20 times higher than that.
Based on the number of cases that we know of.
That we know of.
Right.
Exactly.
Okay, I want to discourage people from saying things like this on Facebook. This is not an apocalyptic plague. They're calling the coronavirus an apocalyptic plague.
Right.
Here at WSA 9, we are all about facts, not fear. We don't want to peddle that sort of narrative. This is a low risk situation, correct?
This is so let me kind of put this in the bigger picture here.
Please.
So 80% of people who get infected that we know of who have had detectable infection do fine. They do fine. They present with mild respiratory illness. We have vulnerable population which we've identified already. These are the people that we have to be very careful about and we have to monitor.
You could have been talking about the flu just now.
And I could have been
Right.
talking about the flu.
So
just
I
now,
should be
exactly.
worried more about my mother-in-law that's 75 now more than my children.
Well,
Almost.
we also need to think about, going into nursing homes, visiting, our parents or our grandparents and being very, very careful, understanding that what we saw in Washington State, that was a very vulnerable population that was affected. And that's why we were seeing those death
Cruise
rates.
ship. I
Right.
mean, all the elderly people on the cruise ship.
Okay. Anybody want to wrap it up? Doctor, you should have the last word. You have just
And
been
I really want to
exceptional.
bring
You've
out
been
our
very good too.
Q&A
Peter, 'cause
research
he's funny.
team.
No, I don't care.
So
No,
Mia and
Doctor.
Laura, do you mind joining us? Because they have been answering your questions behind the scenes throughout this entire show. So I want to just thank you guys so much for your hard
Thanks
work.
for helping us put this on.
Thank you
gang.
guys for
And let us ask you also, anything we missed? I mean, is there any question that stood out, that maybe we didn't get to?
I saw one that I would love to ask.
Okay.
I'm gonna
what
come
is
and
the
give you
risk
my
to
mic.
pregnant women?
That's a very, very good question. So as women become pregnant, they have they have some level of immunocompromise. So we should put them in a vulnerable population. So we have to be very careful for pregnant women. I would put them in a vulnerable population.
Okay.
I felt like I saw so many questions coming through that we could have another 30-minute special. Did you see anything that we didn't cover?
I just keep getting questions from people talking about their own symptoms and who should I talk to?
Yes.
And what we've been telling people is to call their doctor.
I think that's a great idea.
What if they don't have a doctor?
Good point.
That's an even
It's
better
time to get a doctor.
Get a doctor.
But
Get
what
a
if they
doctor.
don't have health insurance and they're afraid to go?
Right.
Can they go to a health clinic
I
in the
have
area?
very good health insurance, and I call my doctor, and I get a nurse practitioner, which is okay. She's very good, but a lot of times you don't get a doctor.
I've
That's
heard
true.
this thing of a super spreader. Could you just
What does
tell us
that
what
mean?
a super spreader is?
Is this someone, I don't know what a super
Yeah.
spreader is. This is my first time hearing it.
Well, a person that would go to big social events and essentially, converse and touch
Intentional?
Okay.
200
I
people.
purposely-
Not
purposely.
intentionally,
Right.
but sort of, just a social person.
So I think what's happening is you've got people at different stages of the illness, right? And so initially, when they feel well and that virus is incubating, they may be infecting other people and they just don't know
Yeah.
it. So they go to conferences, they shake hands, they feel well, and they may be infecting other people.
And a lot of people like Ariana, she's got a lot of friends. She's got a big social
And I'm
network.
going to Vegas this weekend to go see Christina Aguilera. What the heck am I going to
You
do?
might want to
You're gonna
cancel
wash
that. You
your
might want to
hands,
cancel
you're
that.
gonna
Wow.
clean
Shake
your-
hands.
your- your-
Ask
you're gonna
Christina
clean
if she
your
could
tray
come
table.
here.
Right?
I'm just thinking
Thank
out
you.
loud.
Thank you
Yes.
very
Woo!
much.
I love this
Keep
team.
those questions coming to us. We're on
Yeah.
this. We're on this. till
That
the
whole
end.
that whole facts not fear thing.
That's real.
It's not a cliche. It's real.
Can we
And
invite you
guys
both
have
back?
helped
Can
us.
we invite you
Love
both
to
back?
see you.
I want
Yeah.
all your jokes.
Thank you very
by the
much.
way.
Oh, my joke's okay.
The number to get to us is 202-895-5700. It goes right to Bruce Johnson's cell phone. I know you're going to love that.
And I return all of those calls. Okay? That's how you get
Just-
stories.
just
From
sanitize
from
it.
all of us here at the Q&A, thank you very much for staying with us. We're going to be here for you. Promise.